Is massage therapy right for you? And if so, how do you get the most out of that 1 hour session with your massage therapist? That is what we're going to go over today. If you're new to this channel, I'm Tara. I'm a neurologic physical therapist, and on this channel we go over anything and everything related to mobility, health, fitness, mindset in the context of those of you who have suffered damage to your brain or your spinal cord, with the end goal of empowering you with as many tools as possible to take ownership of your rehab and really feel confident that you have the ability to go as far as you want to go in your rehab. And all that being said, it's a really common question that I get from a lot of my patients is, what do I tell my massage therapist? So I thought I'd make a video on what I think the benefits of physical therapy are, as well as some of the key areas that I think are beneficial that you could maybe talk to your massage therapist to focus on during those sessions. So first and foremost, is massage therapy the cure if you have spasticity or abnormal synergy patterns? I would say no, it's not the cure, but I would say it does have some benefits. Some of the benefits of massage therapy are it increases blood flow, it can help to decrease pain, and it can help you to be able to tolerate more movement by having someone get in there and do some soft tissue work on some of those spastic muscles. Now, the road that I really discourage people from going down is using massage therapy to replace all the hard work that needs to go into restoring normal movement. So I think it's really important for me to really emphasize that massage therapy will make the movement retraining exercises more tolerable, but it's not necessarily going to stop spasticity, and it's not necessarily in and of itself going to restore your movement. So really, really important to understand. But let's say you are going to a massage therapist, because I do have tons of patients that do see a massage therapist on a regular basis. And I'm a huge fan. Most of my patients say they feel better after those sessions. They say they feel looser. They don't feel as stiff. All the benefits of a massage therapy session. Now, to get the most out of that 60-minute session or 90-minute session with that massage therapist, I think it's best to focus on the muscles that are prone to present with more spasticity. So what are the muscles that I think are beneficial for a massage therapist to focus on? I would say muscles that are tight, because they will pull your body into some of these abnormal postures that I talk about a ton on this channel. And I would say any muscle where you're seeing like an involuntary contraction. Those are excellent muscles for them to focus on. One is because it'll just tolerate, those muscles will tolerate lengthening a little bit better with the addition of the massage therapy treatments, and might decrease that spastic kind of response when you go to move that muscle. So what are the muscles that are tight that impact people's posture? I would say if we're talking about the upper body, scalene's super duper tight and just shortened on a lot of people. So I think those are great muscles for a massage therapist to focus on. Sticking with posture, the other muscles that contribute to kind of that side bending and forward rotated, or that shoulder rotated forward, that are excellent for a massage therapist to focus on, are the pec major, the pec minor. Those two muscles bring that shoulder forward. So if you're someone that, you just feel a lot of pain when you try and stand up straight, or you feel a lot of pain when you're trying to straighten your arm out, it most likely could be that the pec minor and the pec major, they don't just tolerate lengthening enough. So those would be muscles that would be good for a massage therapist to focus on. And in my experience, massage therapists, they do a little bit of stretching too. So maybe they can combine that with some stretches to stretch those muscles. The SCM, or the sternocleidomastoid, especially if you're someone that has neglect and you rotate your head away from that side or your involved side, those are usually really tight and might really benefit from some of that soft tissue work. So if you're someone where you do get a lot of neck pain and stiffness, again, that could be that those muscles are a little bit stiffer or a little bit shortened. So that would be an area that a massage therapist would be beneficial for them to work on. The biceps, all the bicep muscles excellent area for a massage therapist to focus on, especially because most physical therapy sessions, we really want to be able to get to a lot of the movement retraining. So if you can afford it and you have the means, definitely someone to kind of do that soft tissue mobilization on those biceps. Now remember, every time your arm bends up involuntarily, that is an abnormal response to lengthening of that bicep. So some sensors kind of throw up a red flag when that bicep is lengthened, and it makes them recoil. So it makes them shortened. So by increasing the tolerability of that muscle to lengthen, you're not going to trigger those sensors as quickly. So definitely getting some soft tissue work on that bicep would definitely help a little bit to minimize that involuntary elbow bending. Same with the wrist flexors. Great area for a massage therapist to work on. Again, they're very prone to that spasticity, that same concept I just talked about in the bicep. So that, and then also the intrinsics of the hand, really allowing a massage therapist to get in and work the muscles in that hand, super valuable, and potentially could decrease some of that involuntary kind of gripping that occurs in the hand. Now, going back up to the shoulder, the subscapularis, really critical muscle. Now, full disclosure here, it's not very comfortable when a massage therapist gets into that subscap and does some soft tissue work on that, but the subscap is a huge culprit in keeping that arm rotated in and making it hard for you to externally rotate and bring that arm away from your body. So definitely having a massage therapist that can get in and work that, hugely valuable. Now, some more postural muscles that are very prone to being tight and shortened, and something that I really spend a lot of time with my patients working on is the latissimus and the serratus. All those muscles, great muscles to work on just to make them a little bit more mobile. So all of you, and this happens a lot when I lift people's arms up, that you complain of that pain down your whole side, that is because of all of those muscles that I just mentioned. So if that's something that you're really having a problem with, then maybe you could tell your massage therapist or ask them if they can kind of focus on those muscles. Now, another muscle that I think is really important that a massage therapist could focus on is the Quadratus Lumborum. So a lot of you, when you look in the mirror, if you're really flexed over towards that involved side, a lot of times that Quadratus Lumborum will really lose its tolerance for lengthening and might contribute to you not being able to stand up straighter and more symmetrical and having your shoulders more level when you're walking. So definitely another muscle that is really important or beneficial for a massage therapist to work on. Now moving down to the legs, starting with the hip. So all of the external rotators, all the muscles that rotate that leg out, I find are usually shortened. And so what happens is it makes people less tolerable to internal rotation of the hip. So if you're someone where your knee always tends to be pointed out to the side when you're walking, definitely getting a massage therapist to focus in on the glute max, the glute med, the tensor fascia lata. All these muscles together really keep that leg rotated out. And again, it's always best if the massage therapist is combining this soft tissue work with some stretching. And then moving down to the lower leg, all the muscles in the back that are usually have spasticity in them. If you've had damage to your brain or your spinal cord, so the gastrocnemius, the soleus, and the posterior tibialis, all could benefit from some soft tissue work. And then all the intrinsic muscles in the foot. So if your toes curl and you really feel like you have pain in the bottom of your foot when you're walking, that is because you do have some spasticity or some involuntary contraction of those intrinsic muscles in the foot. So just like I mentioned with the hand, getting in there and just splaying those muscles out can maybe decrease pain just a little bit. So I hope you guys found this video helpful. Again, it is a question that doesn't really come up on this channel a lot, but it definitely comes up with a lot of my patients that I see in person. And so I always kind of communicate with their massage therapist. So now here it is for all of you to be able to maybe show this to your massage therapist so that they can really focus in on the areas that are the most important to you. I hope you guys all enjoyed this video. If you you did, definitely hit that subscribe button. Turn on that notification bell so that you'll get notified every time I upload new videos. Case in point, this is a little midweek bonus video that if you were not signed up or you did not have notifications turned on, you might not have seen this video when it was first uploaded. So definitely turn on that notification bell. I enjoyed spending time with you all today, and I look forward to seeing you in the next video.